Hello everyone. So let's start with the case today. And with the help of this case, we'll be understanding a very important fibroosseous lesion. So let's diagnose the case first. It says that there is a 4-year-old girl who falls down on the playground and is rushed to the emergency. Her workup reveals a new fracture in her right tibia as well as multiple old fractures in her bilateral arms and legs at various stages of healing. Her physician is concerned about child abuse, but communication with the girl's pediatrician reveals her condition. On examination, her sclera are blue. So let's consider a few of the cases, few of the key pointers. It is a 4-year-old girl. First thing is that. Then second thing is that it is presenting with multiple fractures. Multiple fractures. There are old as well as new fractures at multiple stages of healing. That gives us a clue that the fracture might be happening again and again and again and getting healed. Fracture healing, fracture healing. So that is the case over here. At various stages of healing, they are healing as well at different stages. Then there was a line saying that it on physical examination, the doctors find a blue sclera. Then there is a pointer that says that on consulting to the pediatrician, the child abuse was ruled out. The child abuse was ruled out. So here we can see that the trauma was not that much compared to the injury that had happened, a fracture. Like a simple fall will never lead to a fracture. It was a simple fall that had led to a fracture that indicates that the bones are weak and fragile. Plus, there are multiple fractures, so that is clear indication is the fragile bones, which are more prone to fractures. Child abuse has been ruled out. It can be juvenile osteoporosis also, but then we are referring to other examinations and other signs also. So blue sclera is there. Had it been osteoporosis, only the bone would have been affected, but the different other tissues were affected. So that gives us a clear indication of osteogenesis imperfecta. Osteogenesis imperfecta, also called as brittle bone disease. Brittle bone disease, right? We can see the sclera over here. It is appearing bluish to us. The symptoms are the recurrent fractures with minimal force, like even the slightest trauma can cause the fracture. One thing is that often seen during the birth, after the birth, after maybe like it is a disease of the childhood. It is happening since the very beginning. Then there is a case of hearing loss that we can encounter. फिजिकल एग्जामिनेशन पे वी आर एबल टू सी ब्लू स्क्लेरा. अब ब्लू स्क्लेरा क्यों दिख रहा है? देखो, डायग्नोसिस इज देयर विद अस. Let's understand the disease. It is osteogenesis imperfecta, that is bone formation is imperfect. Osteogenesis is imperfect. Osteogenesis imperfecta. What are the considerations now? First of all, there are two steps in the formation of bone. There is the laying down of the organic matrix. Laying down of organic matrix. And then the second step is that there is laying down of organic matrix, and then second step is mineralization. So it is a disease jahan pe mineralization is not getting hampered. The bone formation is normal. Every time the bone is healing normally. But the reason is that it is breaking down again and again. The fractures are getting again and again. Then there might be some problem in the organic matrix, that is in the collagen. So in osteogenesis imperfecta, the genes, it is a genetic disorder. It is a genetic disorder where a gene responsible for formation of collagen type 1 gets impaired. It's an autosomal, most likely autosomal. Type 1 gets impaired. And collagen type 1 is responsible for the formation of mature collagen, and it is this mature collagen that renders more strength to the bone. तो हो क्या रहा है जो fetal collagen है that is not getting converted to the mature collagen, and the result being the bones are fragile and they are more prone to the multiple fractures. That is the problem over here. Now this collagen is present in various other tissues as well. This collagen is present in various other tissues, like it is there in the sclera. It's there in the sclera. It's in the bone, so definitely है. उसके अलावा it is there in the dentine as well. Dentine के अलावा और कहाँ पे होगा? It is there in the lungs. मतलब हमारी it is there in the skin. So multiple tissues it is present. And अगर collagen type 1 का ही defect है, तो why will it only affect the bone? It will affect these different tissues also. We'll see some signs in the dentine, in the tooth also, in the sclera also. That is why we had seen the blue sclera. Blue sclera is formed, the sclera is formed of the collagen type 1. But because of the defect in the collagen forming genes, the collagen is not formed now and sclera remains translucent, and beneath the sclera is the choroid vein. And that choroid vein gives it a bluish tint, a bluish discoloration. Second thing is multiple fractures that leads to limb shortening and bowing. Because there is multiple fracture healing, and that distorts the shape of the patient suffering from the disease. Then there is saber shin appearance of tibia. Saber is a weapon like this, just like a talwar is there. It is a weapon like this. So there is a bowing that is taking place. Saber shin appearance of the tibia. And then there are dental abnormalities associated to it, where the teeth turn brown, and we call such teeth as opalescent teeth. Now, what we need to note over here is that opalescent teeth is reserved for the conditions which involve some bone disorder. We see the similar kind of teeth in the dentinogenesis imperfecta also. But we don't use the word opalescent over here. We generally use the word for the bone disorders, for the systemic bone disorders. Because even though the presentation is same, the brown teeth is there in dentinogenesis imperfecta and here as well, but the difference is in the gene that is involved. The root problem, the root cause over here is the collagen. And that is why the abnormalities can be noted. So for this particular case, we are reserving the word opalescent. Then evaluation, radiographs, we can see the multiple fractures. Definitely, अगर हम radiograph लेंगे, multiple fractures देखने को मिलेगा. Severe cases में scoliosis can be there. Scoliosis can be there. Platybasia can be there. There can be abnormally formed, hypoplastic maxilla can be there. There can be, if we take the radiographs of the teeth region, we can see there can be some pulpal obliteration. The bowing of long bones can be there. We can see all these things. Then we will confirm it with the DNA from the blood or the saliva because it's a genetic disorder, and the protein testing from the skin biopsy. Differential diagnosis, as we discussed, it can be child abuse. First diagnosis can be that, which was ruled out in this case. The other one can be juvenile osteoporosis. But because of the other presenting symptoms, the disease, these differential diagnoses were ruled out. Treatment, it can be multiple. Physiotherapy हो सकता है. देखो, there is no permanent cure for this disease. ठीक है, लेकिन we can still go for certain therapies. We can go for certain physiotherapies. We can, क्योंकि bones fragile है, उसके साथ साथ different tissues that are involved, they are also more fragile and more, the strength is not there. So physiotherapy and learning certain movements, toning the body accordingly can help. Other than that, there is some surgical treatments as well. So हम orthopedic treatment भी कर सकते हैं. Obviously, agar if it is the long bones that is involved, we'll go for orthopedic treatment. If the maxillofacial region is involved, we'll go for orthognathic surgery. If the tooth is involved, we'll go for orthodontic therapies. Okay, but for all these conditions, अब क्या कर सकते हैं? Osteogenesis distraction भी कर सकते हैं. अगर हमको face का size we have to gain back, or long bones का size we want to gain back. So those all of those things can be done. But for these surgical considerations, we'll have to consider ki if the tubectomy can be done or not, if the cardiopulmonary complication is there or not. All those things are to be considered. Then there is the chemotherapeutic agent that generally we use is the prednisone. Sorry, I had to mention bisphosphonates over here. Bisphosphonates. So bisphosphonates, they will inhibit the bone resorption. Other than that, various different therapies can be given. We can give growth hormone, we can give PTH, parathyroid hormone. Then we can go for some stem cell therapy. फिर एक हम मोनोक्लोनल एंटीबॉडी दे रहे हैं आजकल, डेनोसोमैब करके. It's a monoclonal antibody which targets the receptor activator of nuclear factor kappa. So all these things can be done as the therapy. यहाँ पे the main thing is the considerations. Like even if we are going for the surgical treatments, we will have to make certain considerations. Ki cardiopulmonary complication nahi honi chahiye. If the patient is on bisphosphonates, that can lead to different conditions like decreased immunity can be there. So all of those things, or the healing time can be delayed. All of those things has to be considered before starting with the surgery. Prognosis is not very good. It depends from patient to patient. In mild cases, the patient may still survive, but in the severe cases, we can see the prenatal deaths. Prenatal death होता है. And the patient can die in utero in severe cases. There will always be recurrent multiple fractures, and there is no cure to it, no permanent cure to it as of now. Then the prevention can be, because we said that it is a genetic disorder. So if we know the family history, we can prevent it, considering that it is an autosomal dominant disorder and all of that. Complications can be hearing loss, there can be cardiopulmonary complications, there can be neurological complications and all. So the things I missed out upon is the silence classification. First of all, let's talk about the synonyms. Synonyms. Synonyms में इसके है ऑस्टियोसेडेरोसिस भी कहते हैं, ब्रिटल बोन डिजीज तो वेरी कॉमन सिनोनिम, ब्रिटल बोन डिजीज, ब्रिटल बोन डिजीज. Second one is osteosedirosis. Osteosedirosis. Then there is Lobstein disease, because the scientist who discovered it was named Jean Lobstein. Jean Lobstein. इसके अलावा इसको रॉलिक्स सिंड्रोम भी कहते हैं. भाई रॉलिक्स सिंड्रोम, सिंड्रोम वर्ड जो यूज कर रहे हैं इसलिए कह रहे हैं क्योंकि मल्टीपल प्रेजेंटेशन इज देयर. So initially was described by Rollix and was later on given the term osteogenic imperfecta. This is the outdated term that is given to the same disease. And then there is also called as fragilitas osseum, because of the fragile bones. So all of these are the synonyms given to the disease, and it is a autosomal dominant type of disorder. मोस्टली बेटा ऑटोसोमल डोमिनेंट डिसऑर्डर है. 40-45% केसेस में हम ऑटोसोमल डोमिनेंट कंडीशन दिखती है, बट दैट इज नॉट ट्रू. हमेशा नहीं होगा ऑटोसोमल. कुछ टाइप्स जो है इसके ऑटोसोमल रिसेसिव भी हैं. रेयरली इट इज एक्स लिंक रिसेसिव ऑल्सो. एक्स लिंक रिसेसिव भी देखा गया है एक दो टाइप्स में. उसके अलावा स्पोरेडिक भी हो सकता है. इट कैन बी स्पोरेडिक वेयर रैंडम म्यूटेशन कैन कॉज द डिजीज. स्पोरेडिक में रैंडम म्यूटेशन कैन कॉज द डिजीज. क्लिनिकल फीचर्स वापस से वही सारे फीचर्स हो गए. मल्टीपल फ्रैक्चर्स ऑलरेडी डिस्कस्ड. मल्टीपल फ्रैक्चर्स हो सकते हैं. ब्लू स्क्लेरा हो सकता है. ब्लू स्क्लेरा क्यों हो रहा है डिस्कस हो चुका है. कार्डियो पल्मनरी कॉम्प्लिकेशंस क्यों हो रही है, दो रीजन से हो रही है. एक तो कोलेजन टाइप 1 इज अफेक्टेड, तो इंटरनली भी लंग्स की जो स्ट्रेंथ है दैट आल्सो हैज कोलेजन का, या फिर हार्ट की जो वॉल्व्स है दैट आल्सो हैज कोलेजन. तो उस वजह से ऑलरेडी जो है हार्ट फेलियर के चांसेस हैं, या रेस्पिरेटरी सिम्टम्स के चांसेस हैं बिकॉज ऑफ दैट ऑल्सो. एंड अपार्ट फ्रॉम दैट, क्योंकि हमारा जो रिब्स हैं या उसके वजह से भी जो है रिस्ट्रिक्टिव लंग फंक्शन रहेगा. सो कॉम्प्लिकेशंस में रिस्ट्रिक्टिव लंग फंक्शन. हियरिंग लॉस क्यों हो रहा है? हियरिंग लॉस इज बिकॉज ऑफ osteosclerosis. Osteosclerosis. Because of the growth of the abnormal bone tissue in the ears. That will prevent vibrations. Around stapes bone to be particular, and that prevents vibration, leads to decreased vibration and therefore the hearing loss. Then there can be cardiopulmonary problem, cardiac problems, क्योंकि जो हार्ट की वॉल्स है उसमें भी कोलेजन टाइप 1 है. So that can lead to heart failure, that can lead to valvular heart disease, etc. अब इसका डायग्नोसिस कैसे करेंगे? डिजीज का जो डायग्नोसिस कर रहे हैं, एक तो रेडियोग्राफ से कर रहे हैं, बट द थिंग इज कि रेडियोग्राफ जनरली इज नॉर्मल. द इफ वी सी द बोन डेंसिटी ना, बोन डेंसिटी इज नॉर्मल, रेडियो ओपेसिटी वाला पार्ट इज नॉर्मल. It is the shape of the bones that is there. There are the signs of the multiple fractures that can be noted. एंड अगर हम सीरम लेवल्स की बात करें तो सीरम लेवल्स भी सारे नॉर्मल ही आते हैं. सीरम लेवल अगर हम कंसीडर करें, so serum concentration of vitamin D would be normal. Serum concentration of vitamin D would be normal. Calcium is normal. Phosphate is normal. In fact, alkaline phosphatase is normal or can be slightly raised in certain cases, but that is just a normal finding. The reason being कि problem हमारे mineralized tissue में है ही नहीं. The problem is in the organic matrix. That is why all these findings are normal. So we can either rely on the radiographs or we can look for some other tissues, and the most reliable one will be the genetic testing, which is more sensitive than the electrophoresis for the type 1 collagen, right? Coming on to the classification, by silence की classification है the one that we follow. Silence की ने दो classification दिए. One is the previous classification that was given in the year 1979, and it classifies it into four types: type 1, type 2, 3, and 4. Type 1 is autosomal dominant. All of them are autosomal dominant except type 3 that we can see over here. It is autosomal recessive. In autosomal dominant type, we can see osseous fragility, which is variable. Adulthood hearing loss is there. Blue sclera is seen. In the second two, it is extremely severe osseous fragility and perinatally lethal. The child dies in utero. Multiple fractures are there. Both types we can see. Third type is moderate to severe osseous fragility, normal sclerae, severely deformed long bones and spine, and variable clinical and radiographic phenotypes. Type 4 osseous fragility, generally normal sclera, but severe deformity of the long bones and spine. Coming on to the more advanced classification, the recently modified classification, it is involves the relative incidence. The 47% is the type 1 osteogenesis imperfecta. It is all of it is the classification is based on the clinical features. So normal height, mild, short stature. Short stature is generally that we see in the patients of osteogenesis imperfecta. Blue sclera is there, but is not associated to dentinogenesis imperfecta. Perinatal lethal, it is multiple rib and long bone fractures at birth and marked deformities, broad long bone, low density of skull bones on x-rays, and dark sclera. Call A1 is there. Here it is the glycine substitution. Here it is because of the stop codon. In the type 2, it is because of the glycine substitution in both call 1A1 or call 1A2. So this is located on 17q22 chromosome, and this is located on 7q22, 2.2 2 chromosome. Severely deforming, very short. We can see the triangular faces because of the enlarged skull size and the hypoplastic maxilla and the facial bones. They are not that much developed, giving it a triangular faces. Then there can be severe sclerosis, scoliosis that can be seen. Then grayish sclera is there associated to dentinogenesis imperfecta. Type 4 is moderately deforming one, moderately short, mild to moderate scoliosis, moderately deforming one, type 5, and so on. So the most common one is type 1, and then second most common one is type 4 osteogenesis imperfecta. This is the expanded silence classification of OI. So that is all for the chapter, all for the topic, and I'll just end it up over here. See you